After 9 years of working in this Medicare space, I've seen just about everything. The good, the bad, and the mistakes. Hi, I'm Larry Goist, owner of LMS Insurance Group, where we help seniors navigate the Medicare maze. So in today's short video, I'm telling you about the most common Medicare mistakes that I see. Enrolling in Medicare can be a daunting and overwhelming process, but if you seek help from a professional, they can make that so much easier for you. So I'm going to go through the most 5 common mistakes that I see when people are turning 65, and that's all coming up next. Hey, before I dive in, don't forget to like our channel. Definitely subscribe if you find this content helpful. I really appreciate you doing that. Medicare mistake number 1 is do not assume that your coverage from your employer is better than what Medicare offers. So, first off, a lot of people think that if they have coverage from an employer, that they can't drop it and go on Medicare. And that's not true. Once you're Medicare eligible, you have a life event, you could drop your employer coverage and you can go on Medicare. Secondly, you've paid into Medicare for 50 years in your taxes. So if you're running from Medicare at 65, you are avoiding something that you've paid into for 50 years. So I see this so common. People come to my seminars, my webinars, they have no intention of looking at Medicare at 65. They were never going to look because they have coverage from an employer. And this is one of the most costly mistakes I see. Look, the reality is on employer health insurance plans, the deductible is usually $1,000 or higher. If you enroll in Medicare and you have Medicare in a supplement, you have a $257 deductible. If you go on Medicare and you take a Part C Advantage plan, those usually have no deductible. So that's the first reason where people save money on Medicare versus group. But then the second reason you might and probably will save money on Medicare is on group plans. After you've met the deductible, you normally have to pay 20% coinsurance. So you're paying 20% of all costs after deductible. Where on Medicare Advantage plans, you're paying co-pays, fixed dollar amounts. And if you could choose between the two, between paying a fixed dollar amount or paying a percentage of a service, you would want to take that fixed dollar amount every time. Because 20% of a hospital stay is going to be a lot of money. Whereas a $300 copay for a hospital stay, a defined cost, is going to add up a lot slower. So it's not always the case that Medicare is better than your group coverage. But the number one Medicare mistake I see is not even looking at Medicare. So when you are in your initial enrollment period, 3 months before your 65th birthday, you need to compare your group health insurance to what you can get on Medicare. Because again, you've already paid into this your entire life. Okay, Medicare mistake number 2, and this is a big one as well, and that is not doing an annual review. So Medicare annual enrollment period is October 15th until December 7th. At this time, you could make changes to your Part D drug coverage or to your Part C Medicare Advantage plan. And again, the time to do that is October 15th till December 7th. It could be as short as a 2-minute phone call to your broker so that you know what things change in your plan. That way, you're not finding out the hard way in January the following year. Okay, Medicare mistake number 3, and this one is a lifelong penalty. So you cannot delay Medicare B or Part D if you don't have coverage from group health insurance. And the coverage from group health insurance has to be A, considered creditable, and then B, it has to be coming from active employment. So whoever you're getting your insurance from has to be actively employed, and then that coverage also has to be creditable coverage. So if you don't have creditable coverage and you delay Medicare, you're assessed penalties. So the penalty for not signing up for Part B on time Well, you would pay 10% more than everybody else every month the rest of your life when you pick it up. And that's for every 12 months you go without Part B. So if you went 2 years without Part B and you didn't have other creditable coverage, you would pay 20% more every month than everybody else the rest of your life when you picked up Part B. And the same goes for Part D. If you don't have creditable coverage, you have to pick Part D up on time. If you don't, you're assessed a penalty when you do pick it up. Now, the way they charge you that penalty is they charge you 1% of the national average for a drug plan, which this year is around $36. So they take 1% of 36, and then they multiply that by how many months you went without drug coverage. Whatever number you come up with, 1% of 36 times the amount of months, that is what your Part D penalty would be when you picked up Part D. So again, if you don't have creditable coverage, you have to pick up Medicare A, B, and D on time, and you do that in your initial enrollment period, which is 3 months before you turn 65, the month of, and 3 months after. Okay, Medicare mistake number 4, and that is assuming that Medicare covers dental and vision. So under original Medicare A and B, you are going to have no coverage for dental or vision. If you buy a Medigap plan, those are the lettered plans, G, N, F. You don't get dental and vision with that either. You'd have to buy it separately. The only way you're going to get dental and vision on Medicare is with a Part C Medicare Advantage plan. And with Part C Medicare Advantage plans, each package is different. So each is going to offer you a different level of coverage, a different allowance for dental, vision, eye exams, and things like that. But you will only get that by enrolling in a Part C Medicare Advantage plan, as it is not covered under original Medicare. Okay, and Medicare mistake number 5 is not seeking professional guidance. And this should be number 1. Look, guys, the reality is between Social Security, Medicare, supplements, Medicare Advantages, prescription drug plans, you have hundreds of different variables you are dealing with. Okay, could you do it alone? Sure. But what is the odds you end up in the best case scenario? To give you a good illustration of what I'm talking about, I went to Medicare.gov and I looked in Summit County, Ohio. That's the county that has, cities like Akron. Akron, Ohio is in Summit County. It's not even the biggest county in Ohio. And in Summit County alone, as you can see on the screen, there are 119 different Medicare Advantage plans you could pick from. Go over to the drug side. If you do supplement with a drug plan, there's 14 different Part D drug plans you could buy. And if you want a Medigap plan, there's 12 different options for that as well. So there are over 130 different variables, 130 different pieces that you could pick or not pick. So by not seeking professional guidance, you are only getting a fraction of the information. Look, it's always good to ask family members and relatives what they did for their coverage. But without really working with a professional about your unique situation, you're never going to know really what's available to you because there are so many intricacies. For example, there are certain plans offered under Medicare for people that have chronic conditions. These don't show up on Medicare.gov unless you select a certain filter. And even if you selected that filter, you wouldn't even know if you qualified. So that is one of hundreds of examples I can give you of by not working with an insurance broker or somebody directly at Medicare. And I don't even recommend that. Find a broker that takes their job seriously. There's a big difference between somebody that works 9 to 5 at Medicare that answers the phone and somebody that makes Medicare their life, that makes it their career. And that's what we do at LMS Insurance Group, but many other great brokerages out there as well. So definitely seek professional guidance when it's time to make your Medicare decision. And the best part is it's free, as Medicare insurance agents or brokers, we are prohibited for charging a fee for our services. So you are getting free advice, right? How do you know that it's impartial? You don't always know that. The broker could have a motive to sell one over another, but you're giving yourself your best odds of ending up with a great plan by seeking professional guidance. So guys, to conclude, don't make these 5 Medicare mistakes. Number 1, do not assume that your group health insurance is better than Medicare. Number 2, don't make the mistake of not reviewing your plan annually, as things do change every year. Thirdly, do not delay Part B and D without creditable coverage from active employment. Number 4, don't assume Medicare covers dental and vision, because it doesn't. And then finally, number 5, seek professional guidance when you're going through your Medicare journey, as there are over 100 different scenarios and options that you could be placed in when it's time to enroll. So guys, I hope this video was helpful. I'll talk to you next time. Larry Goist, LMS Insurance Group. Thanks for watching.